just wanted to have an opportunity to explain a little bit more of our EAP services to the leaders and the supervisors at Silverbow. So that way you feel like you have the tools that you need to support your teams and employees and are you aware of all the services that we have. Um, so I want to go ahead and start off by talking about what the EAP is, who we are. We currently service all of Intermountain Healthcare's employees, so that's about 65,000. And then we also have other groups that we service that are across the United States. And that's around 120,000 employees that we service. Our team consists of about 30 master's level therapists. Shannon is one of those amazing therapists. And all of these counselors average around 18 plus years of experience. So they're very well experienced. They know what they're talking about. And then we also have a provider network that has, but these are affiliate providers that we're contracted with. There's about 300 plus, and they're all over the United States. So wherever employees are, we make sure that there are providers that can see them and provide the support that they need. So I wanted to go over about who we serve and how you can connect. So our EAP services, first, I just want to highlight they're completely free and confidential. This is a service that is provided for you by Silverbow. So it's all free and confidential. We don't, share any names or any information like that whenever an employee comes to see us. I think sometimes people can be nervous about that. So we just want to make sure that's really clear. And there's also no insurance that's required. You don't have to have insurance to use our services. This is something completely free and available to you. It's also available for all employees as well as spouses or domestic partners. And also dependents age 6 to 26. So if, it's not just for employees, it's for their families. And then we just wanted to highlight that there are a few specific things for leaders and managers to make sure you guys are aware of the services that you can offer. Our phone number is listed right here. You can call that 800 number, or our email address is for our main inbox if you ever have questions or needing to connect. And then we also have 24/7 crisis support. So if you're ever needing in the moment support, that's always available to you. Perfect. So I just wanted to go over what is in the contract here. We've got the 5 session model was selected for the city and county of Silverbow Butte. So what that means is it's 5 sessions per individual per incident. So what that looks like is, say an employee comes in, they're experiencing a rough time, maybe some stresses at work or something like that, and they're needing to get some assistance. They can call in and get 5 sessions with one of our counselors to kind of work through that. And then let's say maybe a couple months later, there was a loss in their family, something else. They can call in and get another 5 sessions for that incident. So really, you can have multiple incidents per year, but per each incident, we try to stick to around 5 sessions because we do offer short-term counseling. If for any reason there was an issue that an employee would need more than 5 sessions, our counselors work with them to help them find the long-term care that they would need. And then we can kind of act as a bridge to make sure that there's the support that's needed in between. Um, I just want to highlight a couple of these services here for us. We'll go over a little bit more whenever we have another onboarding meeting with all of the staff, but there's a few things that we wanted to highlight as leaders and managers that we think that are just helpful tools. But just as an overview, our EAP program, we obviously have our counseling services. We offer manager and supervisor consultations. We'll go over that a little bit more in depth later. Crisis response, group and individual trainings. We offer legal, financial, and elder care consultations. So if you're ever needing any kind of assistance in any of those 3 areas, you can call in and get support. We also do monthly digital promotional materials. So I believe right now Tara and Beth receive those. They can normally come at the beginning of the month, and those can be distributed digitally to everyone. Each month has a different topic with some action items that can be done. We also offer an on-demand resources on our website, and then we also have an app that's rolling out as well. So all of those things are available to you to use or to offer to your teams and departments. And then we also, like I said, have that 24/7 urgent call line. So that's available at any time if you ever need in the moment support. That's what that's there for. So we're going to go ahead and touch on supervisor consultations. I asked Shannon if she could kind of go over this because Shannon is one of our counselors, so she actually is the one that potentially that you could be talking to for that. So go ahead, Shannon.
Yep. So this is mainly for managers, supervisors. Anytime they've got some questions or a concern about how to deal with a specific situation within the workplace, or even personnel questions, how to maybe do some conflict management. That's something that we do offer. And so you can call us, um, and then kind of let us know what's going on, and then we'll get you set up with either one of our internal counselors, or like Katie talked about, that external provider network that we have as well. One of the things that we really want to be able to focus on too is if you're recognizing that that you have an employee that has been a great employee, and now you're recognizing that maybe they're late for work, and or they're just, their mood's just not where it used to be, and you ask them, is everything okay, and they're like, yeah, everything's fine, but it might be even kind of going towards a corrective action, something like that. Think about utilizing EAP. You can contact us, and then we can actually meet with that employee and just help see kind of what's on track, or you kind of help get them back on track. You, as the supervisor, employer, sees kind of those things that they're really not doing, or that they were doing previously and now they're not. But as if we really look at kind of the mental health piece of that, we recognize that sometimes there might be something going on within the family. There might be something going on in the personal life, and with the EAP program, this is a great opportunity to be able to step in and possibly save a write up, or even save somebody from termination, that we could ultimately kind of help with that talk therapy piece. So that is always something that we are here for, and would love to talk to you about and consult with you in regards to that. And so you can either reach out to just the EAP number, you can reach out to Katie specifically, or myself, any number of those ways that we've already talked about that you can get a hold of us. Um, Part of that would be those supervisor consultations as well.
Perfect. Thanks, Shannon. Um, the next piece we wanted to talk about is also the supervisor referrals. Um, and I asked Shannon if she could just speak to this point as well. Again, she would be someone that you'd be working with to get those things sorted.
Yep, and that's kind of, I think that when we're talked about the supervisor consults, I think I probably talked about the supervisor referrals as well. So consults could be more of a manager calling in to discuss a question, or kind of get some different ideas on how to deal with a certain situation. A referral would be where we would actually then talk to that employee that's in question. There's some paperwork that is involved. It's really simple. It's just it's a form that just says, this is what we're recognizing, and this is what we'd like to see. And then it provides a release of information as well, so that we can report back to the manager. Just not specifics of what's going on within the counseling session. That is still a confidentiality piece, but we want to be able to report back on what maybe the manager can do, or even working together, maybe a joint meeting between the employee and the manager, the supervisor, to figure out how we can kind of bring them back to that optimal job performance of what you're really looking for, and what's lacking at this point. So that would be kind of the difference between the consultations and the referrals.
Perfect. Thanks, Shannon. And these are just, I think, some great resources to use as leaders. Like Shannon said, you know your employees, you know the people that you work with, and you'll know whenever they're struggling or might could benefit from having one of these meetings with a counselor, or if you as a manager are just struggling with a difficult situation. That's exactly why we're here, is to help in those situations. And like I said, our counselors are very well experienced and they have some great insights I think that could be really helpful. Okay, the next thing that I wanted to touch on is our training program. There's kind of two different routes. We have a mindfulness program and then also kind of a training program. So, our mindfulness program offers weekly meditation groups. This is something that you could join online just for a couple minutes a day if you're interested, or there's on demand resources that you could go to our website, and maybe just do an exercise or two in between, or maybe to start off a huddle meeting or something like that that's available to you. We also offer in our training program a couple different of like formats that you can use our services. One of them is our mental health minute. So these are 15-minute drop-in sessions that are available with a couple different topics. One of our counselors leads them every time. The topics vary, but it's just a good opportunity just to kind of have a little check-in to make sure you're giving some thought and some energy towards your mental well-being. We also offer live webinars. These are updated quarterly. You can register as an individual or you could register your whole team or department. And the topics vary. Like I said, they're pushed out every 3 months or so. But what I really wanted to touch on with this group in particular is this request a private group training. We offer trainings that can be requested specifically for, it could be for all of Silver Bow Butte, or it could be just for your specific department. I wanted to touch on how you would do that. So what I'll do is I'll just come over to the website here and show you what that looks like up here. Okay, perfect. So this is what our website looks like. You can see we've got a couple different tabs up here that you can go to for information. This will give just general information about our employee services, a couple of the supervisor services that we've already touched on. We're right now on this webinars and trainings page, and then here's our mindfulness page. But on our webinars and trainings, you can see this is where everything is listed. If you scroll down here, this is the live webinar section. We have 30 and 60-minute trainings. You'll just open it this way. It will list the title, a little brief description, the date and time, and you can click there to register. So like I said, this could be for an individual or it could be for your whole team. So these are 60 minutes. We also offer 30 minutes. Again, different topics. The dates will change. Every 3 months, we'll upload some new dates and things like that. And these trainings are refreshed right now every year. So there's new trainings that are offered every year. Here's our mental health minutes. As I mentioned, you can see this is where you could add it to your calendar, just join the meeting for that one session. Again, no registration is required. Here's a couple of the topics that we can cover that we'll be talking about. And then right down here is the training.
I
Oh,
often I often cover that Thursday at noon one, so that's would be a great one to
a good
jump on.
plug. Yes, absolutely. Perfect. Okay, and then I just wanted to highlight here the training request form. So this is just where you would fill this information out. You would put your name, number, email, all of this information. These can be done in person or virtually, so that's up to you. We'll do our best to accommodate dates and times. We have a whole training team that will work with you to make sure you get the information that you need on a day that works. And then you can see these are all of the classes that we offer that you can register for. We just ask here if you want to offer something specific to leaders or something like that, you can put information like that in this comment section. If it's, you're giving a training specific to first responders, let's put that in the chat here or in this comment section here so that when our training team is making sure they're prepared to present, they're offering relevant information that will be applicable to that group. So, I just wanted to show you that information here. We typically try to ask for a little bit of lead time on these. If we can, we prefer 6 weeks, just that way we can make sure we can plan and be prepared. But I think this is a great resource as a leader if you're wanting to take advantage of some of these offerings. Our training program is a great resource. So again, this is just found on our website here. You can click these buttons up here and they'll take you to the correct thing. This is for the trainings if you're requesting those. Perfect. So we'll go back to the presentation now. All right. Okay. One other thing I wanted to touch on is the My Strength app. So this is an app that we have that's available to all employees, spouses, partners, and then dependents as well. The app is called My Strength. We'll say My Strength by Teladoc Health. You can easily log in, just sign up and make an account. The passcode will be Intermountain EAP. And you can see here it lists some of the offerings that it has of topics that it will cover to help kind of give you some resources and tools to make sure you feel like you have some activities and some resources that are available to help in situations where these might be applicable. So I wanted to highlight that and make sure that you were aware of it and that you could pass that on to your teams. And then I think the last thing that I wanted to cover was just this survey. So whenever any kind of employee comes in to use our services, we send out some intake information, and there's some questions in a survey that are optional for employees to fill out. That ask questions like these, how in total number of hours, in the past 30 days, how much has this affect your personal concerns cause you to miss work? Are you struggling to concentrate at work? Are you feeling eager to start your day? Are you dreading going to work? Things like that. This helps us kind of capture where employees are when they're coming to use these services. Um, and what I want to highlight here is actually the results. So after 90 days, we are able to have a post survey, and we have found that just in last year that an average of 22 hours of more productive work time is found, that employees feel like their life satisfaction is improved, their work performance is improved, they're feeling less distraction at work and less dread. I just really wanted to highlight that our EAP services are really here for employees for personal and professional concerns that might arise. So I think that a huge thing is we just want to make sure that you as leaders feel like you have the tools to support your teams and you yourself feel supported as a leader. So I just wanted to highlight that for everyone. And I'll end here with our phone number and information. So again, to reach any of these services that we've talked about, you can just call this number, the 800 number here. Any of the services can be reviewed and you can be coordinated with there. Again, everything is free and confidential. And if you have any questions about that, you can reach out to me as your account manager. I'm happy to answer any kind of business questions or anything like that. And Shannon is a great resource as well. Um, we have, like I said, amazing counselors that are always willing to help. So we'll just open this time now. If there's any questions, Shannon and I would be happy to answer them. Yeah, go ahead, Karen. Looks like your hand's raised.
Yeah, thank you. I think that you may have covered this prior, but would you be will you guys be sharing this slideshow with us or these slides so that we can have them as a resource?
Yeah, of course. Yes, I can have this. I'll send this over to you, Tara and Beth, and you can distribute it. Will that be okay?
Yeah, I think that would be great. Thank you so much.
Yeah, that's
Yeah, I'd
perfect.
like to share some information with with my staff and then maybe reach out on a couple of those. And then you might, another question, if you don't mind. Um, will we be doing that survey that you talked about?
So the survey it's optional. Yes. So all employees, whenever they call in, they call that 800 number. We will, if they're going to meet with a counselor, we send them some intake information to fill out, just basic information that we'll need. Again, all of it is confidential, but a part of that is a survey that can come and they can fill that out. Um, and then again, 90 days after that survey, they'll get a post survey to fill out as well. So everyone who uses the services can opt in to fill that survey out. And then all of the information amongst all of our clients is aggregated, and that's how we pull that data.
Awesome. I would just like all of us to do the survey.
Yeah, it's honestly, I think it's a great way to show, that like where we are in our mental health journey and making sure that we're taking care of ourselves. I think it's a huge resource. This is a great program.
Thank you.
Of course. Perfect. Well, if there are no other questions, then I just want to again end with my email is on here if you ever need me, and our phone number. Shannon, if you want to put your email in the chat, feel free. But Shannon and I are really here to help and support you. It's feeling like you have the resources and the help you need to make sure that you feel empowered with your own personal emotional well-being and also the people that you work with. So if there's anything we can help with, give us a call. I think in about a week or two, we'll have another one of these onboarding meetings. We'll kind of review everything with all of the staff. So that one will be a little bit more generalized, not specific to leader things, but that's a great resource. So, and I believe Shannon has already dropped off some different promotional materials. So check in with Tara and Beth, and I'm sure they can get you some materials. I think we dropped off. We have like a little flip book. I thought I had one over here on my desk, but I don't. But those are an awesome resource. It just has weekly prompts that you can do as maybe like a huddle meeting or something like that that focus on, connection or meditation or gratitude, different things like that to keep our emotional well-being in our mind. So thank you
And I
guys.
like, oh, sorry, Katie. I like that huddle book because it has QR codes, it has links to different things. So it's not just a statement. I mean, it gives you something to do. It gives you some other resources. So that huddle book is a great little book that's full of lots of impactful information and resources.
And if you ever need more of them, Tara Beth, feel free to send me an email and I can make sure we ship some out to you guys. So,
Perfect.
okay. Well, thank you all for coming. I appreciate your time today.
Thank you guys.
You're welcome.
Thank you,
Take
ladies.
care.